For her, every day can bring joy and challenges alike. Every day takes strength and guts and grace. Every day means striving and achieving and caring for others. That's why her health affects us all. But who's committed to keeping her healthy every day when women's healthcare needs have long gone unmet? We are. From helping her breathe easier through any day to making sure she's there for every breathtaking one. We understand that her health is also ours. That's why we're focused on creating a better, healthier every day for every woman, with healthcare they can rely on and solutions they can trust. Because when we care for women, we care for our families and communities too. So at Organon, her care is our greatest commitment, and her health is our everyday.
Hello, everybody, and welcome. I'm Anthony Smith, President of the Southern African Sexual Health Association, and it gives me great pleasure to welcome all local and international guests to this fifth in our Sasha webinar series, hosted in conjunction with the World Association for Sexual Health, and part of a series which paves the way towards the 25th Congress of WAS, happening in September. Tonight, we have upwards of 1,000 people registered, which is very exciting, but we also are very aware that we've got rolling difficulties with our electricity. We're going to have problems tonight. So if you are unable to watch the full webinar tonight, they are going to be available on the Sasha website, on the WAS website. So please join us if there's any difficulty with you as the evening progresses. I want to urge you all to visit the WAS website and the Congress website there's going to be something for everybody in this Congress coming up. We cover a wide variety. It's the most inclusive, most varied Congress you're going to find in sexual health. It encompasses sexual rights and ethics, behavioral sciences, clinical medicine and basic sciences, public health and policies, and sexual education. It's an exciting lineup, so please register and submit your abstracts. Really, it's going to be something very special. Tonight is going to be a particularly exciting group. We have some luminaries in the area of sexual education, important information and important communication for you all. We are going to encourage you to keep up with the usual dialogue that we have come to enjoy in our webinars up to now, a vigorous conversation. So please participate in the chat, ask your questions, and really be part of this from your homes all over South Africa and the world. We want to thank Organon for sponsoring and helping to make these webinars possible, and also to thank all of you for joining us tonight. Just a little bit of extra housekeeping insofar as CPD points, and we often get questions about the CPD points. They are available for all members of SASHA, and we welcome SASHA members and WAS members, so please sign up if you aren't members already. So without further ado, I'd like to introduce the two moderators for the evening. I'm going to give you some relatively short introductions which don't do justice to really the depth and integrity of our presenters, of our moderators tonight. The first is Avri Spilka, who is a counseling psychologist. Hello, Avri, who has a special interest in working psychotherapeutically with identities and relationships that fall outside of the norm. And she is the Gauteng chair of the Southern African Sexual Health Association. I'd also like to give a big welcome to Esther Corona, trained as a clinical psychologist. Hello, Esther, and has worked globally in sexual education, sexual and reproductive health, and gender for over 50 years. She currently serves as the WAS Vice President and co-chair of the International Liaison Committee, and we are honored to have her here tonight. So welcome, Esther, and over to you.
Good afternoon, good evening to everybody in the world. We want, on behalf of the World Association for Sexual Health, to welcome all of you. And just to introduce our matter subject, I want to highlight what has mentioned as the right to sexuality education. Everyone has the right to education and to comprehensive sexuality education from now on CSE. CSE must be age appropriate, scientifically accurate, culturally competent, and grounded in human rights, gender equality, and a positive approach to sexuality and pleasure. And this is to what we ascribe all over the world. Today, we will be focusing on a region of the world, but all over the world in Southeast Asia, in Western and Eastern Europe, in Latin America, in North America, there are groups that belong to us that are carrying very important work in CSC, and this will be highlighted in our coming Congress. But before we go off the WAS subject, I just want to give you some very, very exciting news. As we speak, the Portuguese Parliament has made officially the World Sexual Health Day into a national day. This is the first country that does this globally, and we hope it leads the road for it becoming globally and internationally as it is now, but also officially World Sexual Health Day in September the 4th. Thank you very much. And now, to start our webinar, I would like to introduce Adenike Nike Esiet, and you can find her full biography and data about all her achievements. But what I want to say, and I want to really underline, is Nike's work and commitment and what she has done for CSC, particularly in Africa, but all over the world. Nike has participated in all major in the crafting of CSC internationally, defining what is CSC, and also in ways of spreading CSC all over the world. So, Nike, besides you're doing your fabulous work at Action Health International in Nigeria, I want to really, really thank you for being such a mover and such an inspirer to all of us who work in CSC. So thank you, Nike. Over to you.
Thank you very much, Esther. If I ever needed a marketing director, I know that I have one. Thank you very much. Good evening, everyone. Morning, wherever in the world you are. This is a great session. It's a very, very important session. Important to the extent that, as Esther has said, sexuality, comprehensive sexuality education is a very important endeavor. It's a subject matter that everyone has a right to have access to. You'll ask me, what is this beautiful gift called comprehensive sexuality education? We know that comprehensive sexuality, learning about sexuality itself, is a lifelong process. It's something that we all encounter. How do we relate with others in society? How do we deal with the challenges of our sexuality that we come up with? And exactly whether this is taught or not, we're all constantly learning about our sexuality. However, in the context of education, health, and social development discourses, comprehensive sexuality education actually refers to consciously planned teaching process that addresses the content about the biological, psychological, spiritual, or social cultural aspects of our humanity. It's a process that helps learners develop the skills and attitudes necessary to take care of their sexual health and make good decisions regarding their well-being. Comprehensive sexuality education therefore requires an approach that embraces sexuality as a natural, positive, and healthy part of human life. It addresses the pleasures and joys of our human sexuality, and unfortunately, the not so pleasant aspects. Issues around coercion, sexual violence, sexually transmitted infections. Good sexuality education provides opportunities for individuals to explore their own values, as well as their attitudes, to build communication skills, as well as to build skills to reduce and eliminate risks. The most important thing we have to remember all the time, however, is that sexuality education is not just about reproduction, risks, and diseases. It's also about human rights, and it's about gender equality. And it is about informing people to become agents of their own sexuality in such a way that they have increased efficacy to deal with whatever challenges or issues relate to their sexuality that they come up with. So who should have access to sexuality education? That question has been answered. My presentation will basically be asking questions, 5 questions. Next slide. What is CSC that I've tried to describe? Who should have access to CSC? Where are we now with CSC? What are the gaps in access? and who is being left behind? Who are we leaving behind? And then I'll finally ask the question, hope to give answers. How do we deliver CSE better to those currently being left behind? So the next 2 slides. Who should have access? Everyone should have access. Many times we prioritize sexuality education for young people, but we know that parents, community stakeholders, adults, all of us will benefit from sexuality education. But in the organized sense, a lot of work has been done with sexuality education for young people. Now, let's go on to the next slide. Where are we with comprehensive sexuality education? For the last 3 decades that I've been a sojourner in this field, much progress has been made. My first contact with the body of knowledge called sexuality education was actually in Cuernavaca, Mexico, in 1992 at a meeting on sexuality education convened by the MacArthur Foundation. And since then, around the world, great progress has been made. There has been curricula developed, guidelines developed. Many countries, especially even in Africa, have been implementing national programs around sexuality education, called under different names: family life education, life skills education, life planning education. And many of these programs have been supported by the United Nations agency, led by UNFPA, UNESCO, WHO, UNICEF, and UNAIDS, as well as international foundations and bilateral agencies. A lot of that progress has seen that communities that did not before the last 20, 30 years have access to sexuality education, now have access to sexuality education. That's significant progress. However, that's not what we're here to talk about today. The issues that we're concerned about really are the issues around who are the people that continue to be left behind in comprehensive sexuality education. Next slide. Significant gaps that exist relate to communities not covered. A lot of the work that's been done in Africa has focused on sexuality education for in-school young people. And we know the reason why that has happened. Issues related to the education sector happen in the context of school. It's a good gathering place, especially when we're focusing on young people. And there are many people who have, because of these opportunities, had this access. Unfortunately, there are several groups who are not currently being reached through these programs. Many of them are young people out of school, in rural communities, in poorly resourced urban slums, young people with disabilities, young people who are displaced or in migrant populations or living in humanitarian settings, LGBTQI people, young people living with HIV, young people living with disabilities, people who are using drugs, people who are selling sex, or even young people in detention. These are key groups that current efforts are missing. Next slide. A good way to look at this missing population when we're dealing with young people is to recognize that young people are not homogeneous. Young people are not ageless, genderless, socioeconomically undifferentiated population. They are younger, adolescents, the older adolescents, their needs are different, where you get them may be different. There are issues around gender and sexual orientation. You have to deal with the issues of whether people are male, female, gender non-binary, or their sexual orientation and preferences and the needs that come with those. The same thing in looking at populations. How much access do people have who are in urban areas vis-a-vis those in rural or peri-urban areas? I've spoken about the issues of schooling. What about the living arrangements that young people may have? There are those who are not living with their parents. There are those of them who are even heads of households themselves. Issues around marital status also become very important to consider. Are they married or not, cohabiting in polygamous or monogamous relationships, and issues around their health status, issues of disability, living with HIV, mental illness, and of course the issues of whether they're living in communities that are hard to reach as well. This kind of differentiation of different populations of people becomes the key to interrogate how much access everyone is having who needs to have access. How much of these communities that need to be reached are being reached at the end of the day? Who are we leaving out because they are not in the mainstream of the programming that's currently ongoing everywhere in the world? Next slide. So the question becomes, how can we better reach and deliver the CSC to those who are not currently being reached? How can this be done better? I would like to approach this question by looking at the different categories of people who are not being well reached at this point in time and offer a number of tips about what could be done. Many of the people who are not being reached based on the categories that I've identified, let's take gender first of all. In programming for sexuality education, it's important to recognize the different needs that boys may have in relation to the kind of needs girls may have and how these can be addressed. Specifically for girls, it's always important to pay attention to empowering girls about gender transformative roles. How do we ensure that girls recognize the interaction of power in society in such a way that they're equipped and better able to respond to it? While for boys, it's important that we also pay attention to enabling them to better know how to share power and not blaming them for the structural challenges that exist in society, because truly the issues of masculinity and patriarchy is not the problem of one person. So boys need to be encouraged and be shown that it is not their fault that many of these things exist in society. When we're talking about young people with disabilities, recognizing that there are a wide range of disabilities just as well. So how do we approach comprehensive sexuality education when dealing with people with physical disabilities, intellectual disabilities, or dealing with psychological disabilities, issues around schizophrenia, depression, anxiety, bipolar disorder? What attention do we need to pay? Even in the general mainstream programming, these categories of learners have particular and special needs. When we're working with those who sell sex, and this is a big community, especially in the developing countries, because of the issues of poverty, how do we ensure that programs don't just give information, but they also link participants and learners with opportunities for them to access other services? For those who are in the humanitarian context, in refugee camps, and this is a growing problem, particularly in my country, in Nigeria, recognizing that this is a mobile population. Constantly, they're on the move. There are issues of security that need to be taken into consideration. And definitely, when addressing these issues, we should remember that at the end of the day, the most important thing is how do we ensure that people become informed agents to take action about their own needs and become more self-efficacious. If we pay attention to this and we do more of this in the programming that's out there, then we would be on the way to ensuring that less people are left behind in the work that's currently being done around sexuality issues on the continent. Thank you very much.
Very much, Nike, for this fabulous presentation, which has given us really an idea of the diversity of people, of audience that we are trying to reach, but that at the same time of the universality of certain kind of answers, and also how can we be specific about some of the questions that are posed through sexuality education. And I have one question. What are the key actions that can be taken to serve those that have not been reached? Because you emphasize those that are being left behind, and this is part of the groups that we have to reach. So what are the key elements?
Things that we need to pay attention to. Three important things. Policy and programming needs to align and align with and be responsive to the needs of those that we want to serve. Time has passed that we should be paying attention to just working with groups without figuring out what their needs are. The policies that we put in place and programming needs to be responsive to the peculiar needs of those groups of people that we're working with or seeking to work with. Otherwise, we continue to alienate different groups. The second is that as different from working with learners in the school setting, working with other groups of those left behind, currently being left behind, requires greater thought about managing the modalities for reaching and accessing them, which will not be as easy as it is in the school setting. There are issues around how do we deliver at scale? Do we have the right teachers or facilitators to be working with them? And how do we ensure that people who can work with sign language, opportunities for Braille exist? So how do we manage programming at scale? Finally, there's also the issue of the willingness of stakeholders to collaborate with each other and respect the human rights and diversities that we may find in the field. Those are three important actions that need to be happening if we're going to be reaching those who are currently unreached.
Thank you very much, Nike. We have many more questions, but we will progress towards our next speaker, and then at the end, we will try to pick them up. And if we don't answer them now, we will certainly answer them at our World Congress. So now, please, over to you, Aubrey.
Thanks so much, Nike, and also Esther. That was really a fascinating introduction to what we're going to be discussing tonight, looking at those at those gaps and those different populations that we really need to reach. So before I introduce Osmo, who's our next speaker, I just want to share a quote from his book, The Sexual Mind, Exploring the Origins of Arousal. It seems really relevant for tonight's discussion. He writes, "Sexuality is present in our lives from the moment of birth until death. Each of us is an expert in our own sexuality. It is therefore strange that we know the least and have the least awareness of the very things that are most important to us in terms of sexuality." Osmo is, formerly Dr. Osmo Kontula is a Finnish sociologist and sexologist employed as a research professor at the Population Research Institute of the Family Federation of Finland. He specializes in sex research and sexual science. He is a member of the WAS Advisory Committee, the WAS Scientific Committee, and is chair of the WAS Sexuality Education Committee. You can read his full bio in the chat, which has just been posted. Welcome, Osmo.
Thank you, Afri, of your nice presentation. I start my presentation with a very brief introduction to sexuality education. We already have heard it, some wise words here, but I want to emphasize that to my colleagues that each new generation needs education in sexual issues, and also adults need that sex education during their life course. And education should be evidence-based, means that behind it there is research and there is also introductions to evaluations of projects that have been going on in sex education. And it should provide knowledge and skills that help in building and maintaining a satisfactory relationship and contribute to positive development of personality and self-determination. And as was already mentioned, that education should be based on international sexual rights. And maybe we can have these polls now in the beginning, please. This evidence-based on sexual education, there is a lot of information, what positive behavior outcomes it can create. And UNESCO in the 2016 review has emphasize some of these. You can see this here, but it's not only behavior outcomes, it's also improves attitudes related to sexual and reproductive health. And there's a lot of information, but I can't go into details here. But I want to emphasize that there is a lot of very valuable information, standards and guides in sex education documents that are available. And I think you can see these links via our chat. So there is a standards for sexual education in Europe, that is by WHO, Regional Office of Europe. And there is this UNESCO 2018 technical guidance on sexual education. They both are very good sources of all possible approaches to sexuality education if you need some resources for your work. There are also very important and online resources in international sexual education that can be used in different age groups. And I only briefly mentioned it here, and there are links with all these resources that are available. So I believe that you can also have these links if you have interest via our chat box. Here I list some key principles and aims of sexuality education. As already was mentioned, it's not only about avoiding pregnancy or sexual risk. There is a lot of meaningful information at individual level. For example, how to make informed choices, how acting responsibility, how to have knowledge about human body, how to be able to develop as sexual being and learn to express feelings and needs, how to have necessary life skills in all aspects of sexuality and relationships, how to be able to build sexual relationships that are mutual and work well, how to be able to communicate about sexuality. So all these aspects are also part of the important and key principles of sexuality education. So it's very broad issue, and it helps people according to their life course in many ways. But these are the international aspects of sexual education. But because I'm a researcher, so I have studied sexual issues, and one of my most important issue that I want to say you here, that we should start listening youth really. What are their needs? What is important? What they are looking for? What are their concerns about sexuality? This is about the girls. I later go to boys. And this is based on the most prevalent questions that they have presented on Finnish websites that provide them online counseling in sexual issues. So what they are calling and what they want to hear, most prevalent questions are about changing sexual body and uncertainty about what is normal, how sexual organs, breasts look like, and how they should look like. So they are concerned. So about body functions and body and pubic hair, and they are uncertainty about whether they are normal compared to our girls. And other issues are what they are concerned are about sexual behavior and actions like first intercourse and fears related to intercourse, and what sexual actions are generally accepted and what are considered risky behavior, and how to behave sexually and how to satisfy their partner. This is also important. They are thinking about these issues, how to communicate with their partner. And of course, there are concerns of personal sexual problems. And naturally, for young girls, pregnancy risk is very relevant. So they are thinking about how to avoid this risk in intimate situations, and also what are symptoms of pregnancy. I have also conducted a very large-scale qualitative study of boys, young boys at school age and later, and what are the most important and more prevalent questions and also concerns are, it is the same like girls, if they are normal. So they don't actually believe that they are normal. They feel like they are different than others. And they are willing to know if they are going to be normal when they are adults. And for boys, it's a very big issue if their penis is big enough. And if it's competent enough to satisfy girls and women, that is their concern. They are very unsure. That is a part of their masculinity identity that is very important. And boys also want to understand girls better, how to behave with girls and what are expectations of girls towards boys. And boys consider first intercourse as test of their manhood, and they are afraid how they can behave in that situation. And in the classroom, in the sex education, boys are quite often silent. They don't make any questions. And this is because they want to avoid public shame. If others find out how ignorant and inexperienced they are, it would be shameful. So that's why they don't express what is their real situation. And they also need to survive the sexual crisis with girls that happens quite often. And what boys in Finland would desire, what kind of sex education? So this is based on also very large qualitative study. Most boys would like to receive sexuality education already at primary school at the age from 10 to 12. But that is normal, their expectations. And criteria for good teacher is that teachers would have good expertise and experience, sincere and strong comprehensive talks of sexuality issues with their correct names. So that's what boys are expecting for teachers. And boys especially miss from education the knowledge that meets their interest at that age. So how to integrate them to places and situations where boys' true experiences take place and where related knowledge is needed. So they would not like to listen what will happen when they grow up. They want to know it right now in these situations that they are living now. And boys would also like to hear at school also a positive aspect of sex and of sexual pleasure. And concerning this evidence-based on sex education, I have been able to conduct an evidence-based study in Finland. What kind of sexual education has positive impact on sexual health knowledge? This is very large-scale study, national study. And I have had two instruments in this study. One is the national survey to teachers, biology and health education teachers in 500 schools. So this instrument measures what kind of education they have in their schools. Many details, many aspects of that education. Another instrument is to students in these very same schools, national sexual health knowledge test in 450 schools. So, and this test was a competition between all schools of their sexual knowledge nationally. And best schools were publicly awarded of their sex education. So they really competed of sex education nationally. And the best schools received educational material as a reward. And what was important, at 340 of these schools, it was possible to combine the information from teachers, from school, and the test from students' sexual health knowledge. And so to make an analysis, have evidence what kind of sexuality education was the most effective in those schools. And this is very briefly summarizing associations of school sex education and students' sexual knowledge in these very same schools. So if there was a nomination of teacher that was responsibility of sex education in the school, that helped to students to have a better knowledge. If teachers consider sexual issues very easy to discuss with students, and if aims for the school sex education was to educate into sexual tolerance or to learn natural attitude of sexuality, it's also helped. And if the teaching methods were in most cases drama and role playing or drafting and writing up lectures and lessons, so also it's also helped students to have better knowledge. And if teacher had talked very frankly of his and her life in relation to sex education hours, this personal talk, and if free condoms and examples were provided for students in school. So all these aspects help students to get better knowledge. And this briefly about this sexual health knowledge questionnaire. It has 75 items that measure sexual health, cognitive knowledge, biological and sexual health facts, and not any values or opinions, for example, not of proper behavior. And this questionnaire has been used later in several countries. Just very briefly, how these alternatives look like. Two examples of these questions, the size of breast and the clitoris, for example. And there is a very good evidence that the sexuality education in Finland has improved a lot during the last 50 years, because I have been able to conduct these national sex surveys, and one of these questions is if respondents feel that they have received enough sexuality education at school. And from one survey to another, you have seen a major increase of a proportion who feels that they have had enough. And in younger generation, even 80% nowadays say that they have enough information about sex in schools, and it's improving all the time. And one of the explanations that I find for this good result is that the values or aims of education of teachers, when they rank different educational aims, so what they really want to have in their schools is educating to responsibility and providing correct facts. So these are the most important ranking for teachers that they like to present to their students. And it is interesting that the least, number 14, the least valuable aim was educating to sexual abstinence. Almost no teachers think it's important to teach students. So it's very different values, for example, like in the United States in sex education. And one explanation, I think, that a good result is the quality of textbooks in Finland. This is an example of primary school at fifth grade or 11 years old students, the picture of a textbook that they can read in the classes. And naturally, it's also very important to have manuals for teachers. And there are examples of Europe and Finland, and that we have distributed in Finland to all schools the results of our national surveys, and teachers have been used in a part of the education of our study results. And what is very important, what I have learned about sex education is that the key issue in sexuality education is teachers and other educators' professional training in sex education. So question is, do teachers have training in sexuality education in the basic training in your country? And is there some specialization training in sexuality education available? Are there some organizations that organize courses and training in sexuality education for educators? And if not, what prevents them from organizing that training? And are there some qualifications or professional titles available for educators who have interest and experience in sexuality education? And as a take-home message, if I summarize what I have been presenting and what I want to emphasize is that first, we need to very actively listen all young people what they really need to know and learn about their sexuality issues. And this feedback from young people we need to take into account when we organize any sex education. And another point is that we need to educate teachers and other educators and provide them valid tools for work, and they can distribute this information about young people that they educate for themselves. Thank you.
Thank you so much, Osmo. That was an incredibly detailed presentation about exactly what it is that young people are wanting. And you make such an important point about really needing to listen to young people about what they want rather than imposing what we think they want. So we have a little bit of time to take some questions from the audience. I suppose one of the questions is, and perhaps you can speak from a Finnish perspective, is how does one maintain respect for parents who may have a more conservative view and they are resistant to comprehensive sexuality education? How can you convince them of the benefits of CSE?
Yes, in Finland, teachers and parents, they are communicating via internet, or there are many programs available. And naturally, schools also organize the evenings for parents where they can maybe come to discuss these matters. But what I have heard, what I have understood, it's very seldom that parents are worried about sex education that is going in schools. And one of the strong points in Finland in our education, I think, is exactly that we don't have no religious or other pressure groups that are opposing sex education. Naturally, no at all during the last 30 years. So it has been very easy to organize sex education in Finland, because naturally there are few parents that may be worried and they want that their children are not part of that class, but it's very seldom that happens.
Okay. And in terms of, so there's another question here about addressing gender-related issues. Example, them rather than talking about boys and girls. How is that addressed in Finnish sexuality education?
Finland is gender equality is very high in Finland. In some of these United Nations statistics, Finland is #1 in the gender equality in the world. So it's also very obvious that as a part of sex education, all these gender aspects are taken very, very care. And there is not really so much difference between boys and girls, what we are expecting about their sexuality. And as I mentioned, part of my presentation, when I have studied these young people, so both genders, the key issue that they are thinking about if they are normal. So if girls think that if they are normal in comparison to other girls, and boys think if they are normal in comparison to other boys, so they make reference to their own gender. So that's their major concern, and naturally they want to understand our gender. And we organize sex education in a classroom where boys and girls are together there, so they can listen what others are saying, and they can make questions also. So we are not dividing girls and boys in different groups in sex education.
Okay, I think that I understood the question to refer to people that I suppose don't identify as boys or girls, and whether there's some space in Finnish comprehensive sexual education for people that don't identify as boys or girls, or everybody just taught together.
Yes, that is nowadays included as a part of his sex education as well. So different gender aspects and also different orientation aspects, they are also part of sex education in our school system. Okay.
I think we have time for one more question before we hand over to the next part of the webinar. This is for you. Do you not think that if comprehensive sex education involved two questions? One, do you want to experience sexual pleasure? And two, do you want to have a child? Educating people, especially adolescents, through these two questions would guide sexual exploration and drastically reduce consequences such as unwanted pregnancy. What are your thoughts on that?
Yes, as I mentioned, naturally, girls are worried about the possibility to get pregnant, but more often they actually, and also boys, are concerned how to satisfy their partners. But that is more in their mind of concern, but because they don't know how to act when they meet their partners. And so naturally, when the use of contraceptives is very high, so risk of becoming pregnant is very low in Finland in comparison to many other countries. But so this emotional aspects and communication aspects, they are more complex in Finland actually, and with risk factors.
Okay. I mean, it sounds like many of the issues that you're talking about are the types of issues that we would be seeing as therapists in our therapy rooms, like the question of, am I normal? And how do I talk about it? Thank you so much, Osmo. That's been really fascinating. Please, we will have time at the end during the Q&A panel where you'll be able to ask Osmo more questions, so please keep them coming. In the meantime, we're going to go to break now for 5 minutes, so please take the time to go grab yourself something to drink, and we will see you in 5 for our last speaker, a surprise guest, and for our Q&A panel.
Thank you, Apri.
For her, every day can bring joy and challenges alike. Every day takes strength and guts and grace. Every day means striving and achieving and caring for others. That's why her health affects us all. But who's committed to keeping her healthy every day when women's healthcare needs have long gone unmet? We are. From helping her breathe easier through any day to making sure she's there for every breathtaking one. We understand that her health is also ours. That's why we're focused on creating a better, healthier every day for every woman, with healthcare they can rely on and solutions they can trust. Because when we care for women, we care for our families and communities too. So at Organon, her care is our greatest commitment, and her health is our everyday.
Welcome back. We are very pleased to see that our presenters have really made such an impact on in our audience, and very, very important questions have been posed by now. Some of them will be answered directly by our speakers through the Q&A box, and we will try to get to answer and cluster together some of other questions in the Q&A panel after our surprise speaker. Right now, it's my privilege to introduce Jacques van Sudam. I hope I'm pronouncing well your name, who is the Chief Director of the National Population Unit of the Government of South Africa. His work entails integrating population concerns into the programs of national government departments, provinces, and local governments in South Africa, along with forging relationships with the international community and NGOs to support population and development in South Africa. You can read his full bio in the comment section. So thank you very much, Jacques. I'm sure that you will be presenting a very important issue and linkages in this area for us. Over to you, Jacques.
Thank you very much, Esther, and good evening to all participants and attendees in this very important webinar. Yes, as you've indicated, my area of work is population policy, and I work in my country's national population unit of the government. So I decided to use this opportunity to reflect on the contribution that the population policy perspective, as well as a population unit or commission or secretariat, can make to comprehensive sexuality education. And I'll base my presentation on the experiences in South Africa over the past 25 years. I've organized my paper into sort of 5 parts. Firstly, I'll deal briefly with policy issues, and after that move to some research and evidence, whereafter I'll continue into adolescent sexual and reproductive health and rights programs and use a short example, and then conclude with lessons that were learned thus far about comprehensive sexuality education, as well as lessons that have been learned about the role of population policy in comprehensive sexuality education. First of all, as we all know, the International Conference on Population and Development's Program of Action of 1994 steered away from population policies that look only at statistics and demographic targets, and rather acknowledged the linkages of issues like poverty, human rights, the environment, comprehensive sexual and reproductive health services and education, and the empowerment of women and girls. In South Africa, the ICPD was followed by the development of our own white paper on population policy. And amongst others, our population policy highlighted as concerned the high incidence of unplanned and unwanted teenage pregnancies, the increased risk associated with early childbearing, as well as maternal mortality. One of the major strategies of our population policy is the promotion of the responsible and healthy reproductive and sexual behavior amongst adolescents and the youth, and to reduce the incidence of high-risk teenage pregnancies, unsafe abortions, and sexually transmitted infections, including HIV/AIDS, through the provision of life skills, sexuality and gender sensitivity education, user-friendly health services, as well as opportunities for engaging in social and community life. Now, over the past 30-odd years, teenage pregnancies and the context within which they occur in South Africa has been studied quite extensively. Our population unit, as well as the Departments of Basic Education and Health, formed a teenage pregnancy research coordination team around 10 years ago, which led to better coordinated research, but very importantly as well to better coordinated communication of research findings or evidence into the policy domain. Some of the findings of research across different disciplines over the past 15 years included that the factors that are associated with teenage pregnancy in the country arise from individual as well as family as well as societal factors. So there's not a single set of factors. These include, but are not limited to, culture, religion, values and beliefs, education and economic circumstances, and the lack of support structures. Some life circumstances place girls at higher risk of becoming teen mothers. These include poverty, poor school performance, a family history of teenage pregnancy, and socioeconomic inequality. Partner age is also seen as a significant risk factor when the male partner is older than the female partner. Other contributory risk factors include early sexual debut, ignorance, curiosity, peer pressure, gender-based violence, power imbalances in sexual relationships, and family conflict. Furthermore, although sexual and reproductive health services exist throughout the country and are geographically fairly accessible, the utilization of these services by young people prior to their first pregnancy is limited for various reasons, which include societal values and morals, the judgmental and negative attitudes of healthcare workers, especially with regard to contraception, and then practically financial constraints. For example, the transport fare to get to the nearest clinic. If I can then move on to broadly our adolescent sexual and reproductive health and rights programs and the service delivery environment, I think first of all, important to just note that sexuality education has been part of South Africa's life orientation curriculum in schools since around 2000. The Department of Basic Education has also developed guidelines for sexual and reproductive health and rights services in schools, which are aligned with our country's integrated school health program. Several policies and programs are in place that are complementary towards the implementation of sexuality education programs. But often, however, our sexuality education programs are funded on an HIV/AIDS budget line, and often with donor funds. Now, just to bring in the population policy perspective, we've over the past 15 years done quite a lot of work to study the prospects for the so-called demographic dividend in the country and to advocate for interventions that would support the achievement of the so-called demographic dividend, which basically rests on three pillars. One, of course, is education and skills. The second one, jobs and employment. And the third one, health, including sexual and reproductive health and rights. And in that analysis, we've identified that in terms of the attention that youth strategies pay to the elements of the demographic dividend, the one that was receiving the weakest attention and therefore resources was sexual and reproductive health and rights. So from within the population unit, that basically implicitly mandated us to facilitate intersectoral and multidisciplinary work on the issue of adolescent sexual and reproductive health and rights. One of the outcomes of that work has been the adoption of a national adolescent sexual and reproductive health and rights framework strategy by Cabinet in 2015. The strategy was developed as an explicit strategy to bring stakeholders together. It is underpinned by evidence on various and diverse aspects of adolescent sexuality in South Africa. The evidence, for example, indicated that there were quite a number of gaps that existed in the promotion of young people's sexual and reproductive health and rights. The framework strategy has 5 key priority areas, and those include, first of all, increased coordination, collaboration, information, and knowledge sharing among stakeholders. Secondly, to develop innovative approaches to comprehensive sexual and reproductive health and rights information, education, and counseling to adolescents. Thirdly, the strengthening of service delivery and support on various sexual and reproductive health related concerns. Fourthly, the creation of effective community supportive networks for adolescents. And finally, to formulate evidence-based revisions of legislation, policy, strategies, and guidelines. So, although there was a body of evidence to support in-curriculum sexuality education programs already in place in the country by that time, and the body of knowledge also supported a view that of improving knowledge and behavior is effective in relation to adolescent sexual and reproductive health. There was much less clarity on how to implement these programs and how to scale them up in diverse contexts. So what was specifically identified was the need for developing a comprehensive sexuality education implementation framework in the country. Benchmarking studies were organized by the population unit because of the more sort of international mandate that we have, in partnership with the Department of Basic Education, with the aim to learn how to develop both a comprehensive sexuality education curriculum as well as an implementation framework for the country. The implementation framework that was developed on the basis of these studies contained the following elements. One was strengthening of the curriculum. Secondly, teacher training and development in terms of sexuality education. Thirdly, we reviewed online sexuality education courses and adapted for the South African context, and also provided guidance to have such training courses accredited. But also psychosocial issues were identified, as well as we provided guidance on textbook revision. And following the development of this implementation framework, the Department of Basic Education led a vast array of consultative meetings with stakeholders from both within government as well as outside of the government, to basically sort of, you know, discuss and advocate for the framework. The National Population Unit provided technical support through workshops, and also in the rollout of online teacher training, as well as in the development of teacher learner support material. So what we've learned out of all these experiences, particularly for sexuality education to be comprehensive, is that, first of all, good quality sexuality education needs to be delivered at scale on a sustained basis to make a significant impact. And it needs to become institutionalized within national systems of education. Institutionalization of sexuality education on a sustained basis is a key contributor to social change by influencing social and gender norms, which ultimately does not only benefit public health indicators, but crucially the holistic well-being and development of adolescents. Coverage alone is not the sufficient measure for scaling up. The quality of programs offered is also critical if young people are to gain the knowledge and skills they need. Gender-focused programs are substantially more effective than gender-blind programs in achieving SRHR outcomes. Key aspects of sex and sexual health that should be covered include information about reproduction, sexually transmitted infections, abortion, and practically where to access sexual and reproductive health services. Educators should be developed to deal with sexuality issues, should be equipped to deal with sexuality issues so that they are comfortable talking to students about sexuality. It is imperative that the taught curriculum gives topics about sexuality more prominence and draws the links to social issues and identity, gender roles, discrimination issues, and sexual orientation, puberty, love, and responsibility. To be comprehensive, sexuality education should encompass multiple settings that include schools, but not only schools. And I'll come back to that point maybe later if I have time. Now, just finally to reflect on the contribution that the National Population Unit and the Population Policy Perspective brought into the comprehensive sexuality education endeavors of our country is, first of all, a population unit or secretariat has a very large convening capacity because it's created to convene different sectors, both within and outside of government, into the same spaces. Secondly, a population unit provides a sort of beyond the schoolyard and beyond the classroom perspective in sexuality education. Of course, by its very nature and mandate, a population commission or unit or secretariat has research capacity and a mandate to coordinate research in an interdisciplinary way, and beyond the line function restrictions that one obviously often finds in education ministries, for example, or health ministries or so. Population units look at the relationship between indicators and across time. And all of this obviously provides a capacity to do a holistic presentation of evidence to key decision makers in resource allocation, so that such decision makers can actually relate to adolescent sexual and reproductive health and rights issues to their own sector or sphere of interest. And I think from our experience, that's basically sort of a contribution that contributed to better CSE as well as to a better sort of, resource commitment from many spheres into CSE. Thank you. I'll stop there. I see my time is up. Thanks very much.
Thank you very much, Jacques. I'm very impressed by the similarities of the National Population Unit and other population units, for instance, in Latin America. And the fact that the ICPD, the International Conference on Populational Development, back in '94 was able to spark this the interest in and the linkages between CSC and population matters, to see that they are related. They're both based on human rights, and that they can act in synergy to produce public policies. There have been some very interesting questions related to your work, and one of them is what are the implementation challenges when it comes to CSC in South Africa, and how can they be addressed?
Yes, I can highlight a few. Thank you very much, Esther, for that question. I think a major one is the strength of life orientation training in our country, in which sexuality education is located, is that it is not taught like other school subjects where you write exams and so on and so on and so on. Of course, the probably unintended consequence of that, being a non-examinable subject, and particularly at the level of grade 12, when students complete their high school, there is no exam for life orientation and therefore sexuality education, which basically means we've got no way to monitor and evaluate whether or not learners are well informed regarding issues related to their sexual and reproductive health and rights. And we've got no mechanism with which to see whether teachers have implemented the curriculum content that's supposed to go hand in hand with obtaining a pass for life orientation. Secondly, which I think is probably a general challenge around most of the developing world, is that schools and institutions that are located in poorer communities and in rural areas often lack the resources to provide adequate training to teachers. In addition, one often finds in poorer communities a much more conservative method of education, and that is often not compatible then with the content and goals of sexuality education. So therefore, the need to train teachers on comprehensive sexuality education, including at academic institutions whilst they are still at university, is clearly important. And then I think finally maybe to mention that our Department of Basic Education is very committed to implement sexuality education in schools, but the training and experience among the educators to do this continues to be a key issue. Moreover, life orientation educators often feel isolated and singled out as being the sole coordinators of sexuality education in the school, and they often encounter lack of support from their colleagues. So that's just to mention a few.
Thank you very much. I'm also very impressed that you have addressed this special issue of scaling up. How do we go from pilot projects to small-scale projects and really international projects? So the South African experience is very, it is enlightening to all the world. However, I have noticed that you sometimes have not referred to comprehensive sexuality education in your talk. Why is that?
Well, for sexuality education to be comprehensive, it has to be in every classroom, and the whole curriculum has to be taught by appropriately trained teachers. The services environment should play a supportive role as well. For example, in the health sector, even social security and social protection programs, etc. Obviously, parents have to understand their role. The articulation of policy and legislation by political leaders needs to take place. And of course, the media should portray supportive messages as well. So one cannot in the classroom only deliver sexuality education and then it becomes comprehensive immediately or automatically. To be comprehensive, one has to be sure that it gets delivered in quality everywhere and that all the support services are there. Thank you.
Thanks, Jack, for this very comprehensive answer. And now we go over to our next speaker, and I hand the microphone and screen over to Aubrey, please.
Thanks so much, Esther. And Jacques, that was an excellent point, and I think it leads very nicely into our next speaker, who's our surprise speaker, Casey Blake. Casey is a registered counsellor in private practice in South Africa. She is the creator of Tools for Having the Talks, a series of workshops for parents and caregivers on how to have age-appropriate conversations with the children in their care about sex, bodies, touch, and more. Casey, I'm going to hand over to you, and perhaps you can explain why the point that Jacques made was so relevant to what you're about to say.
Thank you so much, Aubrey. Jacques, I cannot tell you how excited I am that you have mentioned what you did when you answered Esther's question, because it speaks to what I'm talking about. So I did my master's research on students, university students' experiences of school-based sex education and whether or not they thought it was helpful as they were becoming young adults and navigating relationships. Short answer is no, it was unhelpful. But I'll give you a little bit of detail as to what came up. So, because the lesson plans are scripted, but like Jacques said, there is no way to ensure that the schools actually follow the scripted lesson plans we've got. Every school has its own way of navigating what they think is appropriate for their learners to have, and that results in vastly different experiences of sex education. I can't even say that we have CSE in this country unless because only specific schools have more comprehensive content. All right, so I'm just going to tell you a few of the highlights of my results. So I found that students said that when their classes were gender separated, so by a binary gender, girls or people who are assigned as girls in one class and people assigned as boys in the other class, most students felt like they were getting incomplete information and that the other class was getting privileged information that they were not privy to. There were comments about how do they know we're going to date in the school system so that we have complete information as a couple if people are heterosexual? So there was a lot of concern around the fact that students felt they had incomplete information. They didn't know how their own bodies worked, and they definitely did not know how other bodies work. There was no student in my study who spoke about learning about pleasure. There was a few students who spoke about how they learned about their own pleasurable anatomy through their relationships at the end of high school and in their first year of university when I was interviewing them. So no mention of pleasure or even actual anatomy. There was minor mention of lubricant. There was, out of my whole study, only 2 people knew about lubricant. One thought it was a contraception. There was no mention about how condoms are more efficient when there is water-based or silicone-based lubricant used. There were stories that their teachers had told them that condoms were just as effective as not using condoms because they break easily, they're badly made, or they've got their instructions stapled onto them. So school teachers were telling students in school not to use condoms because you're just as protected with it as you are without it. Talking to the inclusion of LGBT queer issues, nothing. The queer people in my study said that there was nothing for them about how to be safe because they're not going to fall pregnant, and the focus was on pregnancy. There was also no understanding about how condoms work. So in addition to the fact that they don't work, how do they help prevent pregnancy and how do they help prevent STIs transmission? Completely absent. The focus on don't get HIV completely alienated students who were born with HIV or who may have been victims of violation and then got HIV as a result. So it increased the stigma and shame around HIV instead of helping create a space to limit and decrease the stigma. Also, some of the schools did not do condom demonstrations. There were no students in my study who were from the same school, so I had quite a vast range of school experiences. Some had no condom demonstrations because their school thought it was too sexual for the students who were having sex in the back classrooms anyway to officially learn how to use condoms in a class that was made for this. I've mentioned the anti-prop. Oh yes, students felt very scared of sex. They were often given the message that you will get, if you have sex, you will get AIDS and die. No HIV, no mention of the fact that we're in like the mid-2010s at this point. So ARVs are a thing. HIV is not something we die from anymore. And their message was, you are going to get AIDS and die if you have sex. You're going to get pregnant and your life will be ruined if you have sex. There was also, so there was no preparation for their sexual debut. There was talks about one of my participants, I see my time, I'll end on this one. One of my participants said that she doesn't understand why people talk about sex being pleasurable, because in her experience, sex is for her partner and it's the only way to keep him there. There is nothing in it for her and she wishes it never happened. That broke my heart. There were also conversations about violation, people not being sure what violation is. Have they violated someone? Have I been violated? These were conversations that happened in my focus groups, which were beautiful to watch, but devastating to listen to. Last point, because it spoke to what Osmo said. Sorry, I am stealing some time here. That children felt that when they got sex ed from a nurse when they were in grade 7, so age 12 to 13, that was the most important, informative, fact-based thing they ever got. None of their LO since then has been helpful. Or when they finally had LO, so life orientation is LO, when they finally had life orientation content, it was already what they knew. So they tuned out because it wasn't relevant information. But at the same time, they couldn't ask questions because they didn't want to be stigmatized for not knowing it already. By the age of 13, children feel scared to ask questions because they're supposed to magically know it. So if we're only starting sex ed after the age of 13, we're clearly starting too late. Thank you.
Thanks so much, Casey. And, so refreshing to have kind of a real, live on the ground feel about what young people are missing, like what the gaps actually are. We do have a few minutes before I'm going to hand over to Esther to introduce the panel. So I can see that there are a few questions that the audience members have asked, and I'm wondering whether you can address them. So the first one is about when to start introducing talk about gender into sex education. Keeping in mind that will inevitably start to lead into talks about people who are transgender or gender non-conforming.
Thank you. Beautiful question. I think we should start talking about gender when we start gendering our children. We gender our children based on their gender assigned at birth. And as they grow up and as they become verbal, they start interacting with the world in a very gendered way. So I think introducing the idea of gender, that gender does not equal your genitals, that your gender experience may not match exactly, and that there's lots of ways to have a gender expression. I've got lots of clients whose children are cisgender, but also gender non-conforming, and have to fight their school system for a little girl to wear a blue backpack because the school says that's for boys. And she's like, no, blue's my favorite color. I'm going to do that. That's gender. And she's 6. So I think we really have to start introducing the idea of gender and the possibility of being trans or gender non-conforming or non-binary at a very young age, because that's when children experience it. So if we can talk about it, we can acknowledge and validate their experiences, and hopefully there are less people who are prone to committing suicide in their teens because there's no place to be seen.
Thank you so much, Casey. Okay, one last question. How do you manage feelings, emotions, passions, and sexual education for adolescents?
Oh, beautiful. I think we have to start with navigating how normal rejection is and how good rejection is. And how when we get rejected, it is a gift for everybody. It's a gift for us to be rejected, even though we can't feel it in the moment. But if somebody can reject us in a nice, polite way, obviously, not in a mean, bully kind of way. But if people can reject us, then we are saving both of us the difficulty of an unhealthy, unsatisfactory relationship. It also helps us learn about boundaries. So these things, when we can talk about boundaries, when we can talk about how I am comfortable with this, but uncomfortable with that, how do we navigate what makes me comfortable makes you uncomfortable? And these are all in a non-sexual context. If we talk about sitting next to each other, friendship groups, all of these things, when we have these conversations with children before adolescence, ideally, then we're able to translate these skills into a sexual conversation so that passions don't take over, because people can go, actually, hold on, I don't think I'm comfortable with what's happening. Can we talk, or I'm going to leave? But until we have that skill to do it when somebody sits too close to us on the couch at a party, we definitely won't have that skill to do it during a sexual interaction.
Sure. Okay. Thank you so much, Casey. And Casey will be around to answer some more of the questions that have been posed in the Q&A box. Esther, I'm going to hand over to you to introduce the panel.
There are lots of questions that have been posed by our audience, precisely on gender and also the LGBT community. How do you address, or how do you work CSC within these communities? But before going into that specific field, I think that we are going to precisely try to answer as many questions as we have here in the Q&A box. And we ask you that if you have any more questions, please do write them in the Q&A box or in the chat box, because these very rich experiences that our speakers have brought to us, we hope to be translated into actions in each particular region. So I'm going to start with a question which I think Nike might be able to address, because she has worked precisely with these groups. Who should be the providers to work with at grassroots level, and how do we work on CSC at grassroots level? And I may expand the question out of school, because we have addressed mainly in school programs. But what about out of school, which you address these hard to reach populations, or those that are left behind? And many of those are precisely out of school. Over to you, Nike.
Thank you very much. I actually have been answering some of the questions in the question box. They're disappearing. But in terms of working with young people in hard to reach communities, and all of that, this session is really about the left behind. I'm struggling not to focus on those who are in school, because they are the privileged ones. And if you're speaking in Africa, there are many people who are not in school. So it therefore becomes very important, if we're not going to continue to have them left behind, to begin to think about structures within communities that can help with sexuality education. What is the role of parents? What is the role of caregivers? What is the role of mentors? What is the role of role models within communities? What is the kind of opportunity that's presented through age grade associations that happen within communities? What are the kinds of opportunities that are presented with the rites of passage that young people go through within communities? So these are the opportunities that exist for reaching those who are currently not being reached. at the grassroots level. And we constantly have to begin to think also about schools and the limitations that schools bring to bear on access to comprehensive sexuality education. Many school boards and school management committees have restrictions about what you can talk about. And I can talk specifically about the experience we had in Nigeria when we were advocating for access to comprehensive sexuality in the school curriculum. It was easier for the education authorities to say, no, you cannot talk about certain topics within the context of school. But within communities, we make the mistake many times of thinking that communities are too conservative, they won't talk about these issues. But people are having those experiences and they're talking about those issues in culturally appropriate ways. You know, people talk about homosexuality in the context of it not being appropriate on the African continent. But there are many experiences that people are having that it's clear that there are relationships going on between the same sexes, and people in communities have ways of discussing those issues. So let's not shoot ourselves in the knee by not moving forward, thinking that they are conservative views when there are actually restrictions that we are placing on ourselves in terms of how to give that kind of education that's comprehensive to those who require to have that information.
Thanks so much, Nika. I mean, that's such an important point that you're making. And I suppose that I want to segue into, other types of restrictions that happen in kind of like, I suppose, a school setting. So we have a question here, and I'll open this up to anybody in the panel who wants to respond to it. So recently, a number of high schools in South Africa have been dealing with learners wanting to celebrate Pride events, because it's Pride Month at the moment, or starting LGBTI clubs, with anxiety and disapproval sometimes coming from parents and school leadership. Can CSE address the more systematic challenges of homophobia and transphobia in school and in family systems? Who would like to tackle that one?
I have started typing an answer.
So Casey will go to you, and then we'll hear from Jacques and then from Osmo.
Perfect. So I've just started typing an answer that I think we need to, like Adenike and Osmo have said, we need to have continuous adult education as well. So I think when we're I think one of the things we have missed when introducing CSE into our schools is we've missed introducing it into families and having community engagement about what is comprehensive sexuality education. I think that so many parents hear sex ed and literally think porn, because for so many of us, that was our sex ed. So we have to educate the parents about what is it that happens in comprehensive sexuality education. It's actually more about relationship education and how to navigate relationships healthily before it's even about sex, because if we start at sex, we lose everything. So we have to start at a foundation of relationships and communication. So I think I'll leave my contribution there and listen to Jacques and Osmo.
Great, thanks so much. Jacques, can we go to you?
Yes, thanks very much, Aubrey. Yes, I've also seen the question around the things that happen in South African schools. I think one obviously is, just to continuously emphasize that comprehensive sexuality education needs to be connected to a range of social issues, and particularly needs to be located within gender-related issues. And with gender, I refer to gender as the continuum, not as just boys and girls issues. So I think that part's important. But obviously, if one is really serious about seeing a difference at school, we need to change our approach to the recruitment and appointment of life orientation teachers. The irony is, to be a mathematics teacher, one has to have a qualification in mathematics. To be a history teacher, you have to have a qualification in history. But to be a life orientation teacher, in many instances, you don't really need any qualification. You are just picked because you seem like you have the personality to talk to children about life issues. So I think we need in our universities, as well as obviously in our education department, we need to create some kind of a recognition of what constitutes a qualified life orientation teacher, which has to include obviously a formal training on how to conduct gender and sexuality education. I think just to sort of briefly pick up on what the point that Casey made as well on on community, because obviously, I mean, schools exist within communities, and both teachers as well as children who go to school live in communities, and that's one of the interesting things that we picked up in the research and tried to address through the framework strategy was the fact that one needs supportive sort of networks and systems within communities. Now, a program that we embarked on when we identified these research findings and rolled out in a number of places in the country was a dialogue program, which we called Ezabasha, which basically means to talk. And what we would do is, together with, say, the local welfare office or the local clinic or local teachers, convene a community meeting, like a half-day meeting, to which we invite everybody from the faith sector, young people, old people, and then one gets all kinds of participants, many people who are just community members and they heard about the meeting and it's interesting. And what we did in those dialogues is to briefly introduce several issues around young people's sexual and reproductive health and rights, and then leave it for the participants in the meeting to discuss and dialogue. And what was very striking and interesting was the need that so many people had to be able to discuss young people's sexual and reproductive health and rights issues. It's just that they don't have the spaces within which to do it, because it's not an appropriate thing to do at the church or to do at the parents' meeting or whatever, and just the creation of that space, one would then see the opening up of young people and their parents and their grandparents and so on, who just talked. And, from the conversation, one would typically see that, like, people start realizing, but we all have the same questions and we all have the same concerns and we all have the same need for information. So what often then happens in such a dialogue is that the participants sort of, just put together their own committee or whatever, like, we are going to take this thing further, and they get the nurse and one of the teachers into it and some parents, and then they start the community program, which obviously then just runs. They come back to relevant government departments when they need information or services or whatever. But it was amazing for me to see how open South African communities are for an engagement around sexuality issues. And it's almost like people want to have the issue demystified for them. With that happening in a community, in many instances, we then saw a feedback loop back into schools, where the life orientation teachers ended up getting more support from parents, et cetera, to do their job, because people, realized basically that this is important to all of us, and we should support those who are employed to do this kind of work. Yeah. So I'll stop there, just because otherwise I can continue the whole night.
Thanks so much, Jacques. And I mean, I know this is a very meaty topic, and we can go very deeply into this particular issue. Let's hear from Osmo, and then we'll go on to the next question.
Thank you. I can't comment what is going in South Africa, but I have another issue in my mind that I want to tell you all. As it has been mentioned, WAS has Sexuality Education Committee, and we have also network of sex educators. It is more than 100 sex educators around the world that are part of this network. And if you have interest to join this WAS network, We work via Facebook group. It is WAS network. And if you see my name here, so if you look my name in Facebook and you contact me, I can invite you to be a part of this WAS network group. So it is open to you all if you have interest to communicate with other sex educators around the world. So you are very much welcome.
Thanks so much, Osmo, because I've seen in the comments and in the questions that a lot of people are interested in getting their hands on a curriculum or mentoring or coaching around being a sex educator. So that would be a really wonderful resource. Thank you so much. And Osmo's details have been made available in the chat, so please feel free to contact him about that. I'm just going to hand over to Esther. Is there anything in particular that you're wanting to, any questions that you'd like to ask the panel?
Yes, there's a very interesting question specifically for Osmo, but I think it may be addressed also by other panelists. Do you think that CSE involves two questions? Do you want to experience sexual pleasure? And two, do you want to have a child? Educating people, especially adolescents, through these two questions would guide sexual exploration and drastically reduce consequences such as unwanted pregnancy. Maybe Osmo would like to comment on these very specific approaches to CSE.
Thank you, Esther. I'm not sure if I get exactly what was the question, but there was a sexual pleasure and having a child. And they both issues are included to sexuality education. And nowadays, young people more and more, they expect that they will hear in education also about these pleasure aspects and also how they can provide pleasure to their partners. And naturally, they also want to know how they can become pregnant if they want to have it. So this reproductive issue, it has been always a part of this sex education, but nowadays also sexual pleasure has become a part of this education. But I'm not quite sure what was the key of this question, so if I answered it or not.
Thank you, Osmo. I think that maybe restricting this CSE to these questions, it's very limited, particularly when we have heard from other speakers how to integrate relationships, rights, and of course a gender perspective. There's another question which has come up in the chat box, which relates to something that has already been said, and it is the approach of adults. Would we need or expect teachers and doctors, etc., to believe what they teach in order to teach it? This is something like the informed consent of, or like this, not informed consent, but the fact that in some professions, there is this objection, this conscious objection. It really relates to this. This is maybe a stumbling block in our schools where teachers may not subscribe to the methods or contents of CSE. Will our work be first to change their take on CSE, or just they should teach it? Is it possible to teach CSE from a neutral basis? Over to you, Mike.
Thank you. I think for me, this is a very, very important question. And it begs the question about who should be teaching comprehensive sexuality education. You cannot give what you do not have. In my own experience in doing this work, anyone who we will foist on our children to teach them about sexuality should also have gone through education around these issues. They should have had an opportunity to clarify their own values about sexuality, what their viewpoints are, such that we know that they will not be bringing their biases, because each one of us has biases from our socialization and where we're coming from. And we don't begin to foist this on the audiences who we have power over. Because remember, teachers and doctors have great power. And professionally, sexuality education is taught in institutions in the Western world. In fact, for us in Nigeria, when we were popularizing the comprehensive sexuality education curriculum, we spent a lot of time preparing the teachers who would go into class to teach it, because everybody is coming with their baggage. And that baggage, we can't expect them to foist on young people. The other issue is the clarification of the point of view that sex equals sexuality. If we don't take anything away from this webinar, the one thing I would love all of us to begin to talk about is making a point not to call sexuality education sex ed, because it enables people equate in their minds that we're only talking about sexual activity. And I know that's going to be difficult for many professionals, especially sexologists. The truth of the matter is that there's great weight in a name. If you go through the content of comprehensive sexuality in the ITGSE, it's more about relationships, and I'm not talking about sexual relationships. It's more about personal skills. It's more about taking responsibility. And these are the issues that people need to begin to disabuse their minds if we're going to be successful in this entire endeavor of creating access to more people around sexuality education issues. Sex is not equivalent to sexuality. Sexuality is the total expression of who we are, male, female, gender binary, whichever it is we are, is an expression of our humanity, not just sex and biology alone.
Well said, Nike. This is really a very important point. And the way that we train teachers, and what are we training in them? Not only in cognitive matters, but we're also training, hopefully, in a revision of attitudes and exploration of their own values, and the fact that CSE should be transformative. And therefore, this is the real way to integrate all these elements. Over to you, Abri, to other questions that have appeared in the chat box.
Sure. So, I mean, we're coming almost to the end of our time. We've got 5 minutes. I've noticed that there are at least 2 questions that refer to kind of mental health issues around the delivery of sexuality education. The one is about whether, there's, I suppose, educators should be skilled in dealing with people that have experienced sexual trauma and how that would be dealt with. And the other is about whether there's any evidence to show a link between comprehensive sexuality education and positive mental health outcomes. So I'm going to pose that to the panel. Is there anybody that would be willing to tackle mental health and comprehensive sexuality education?
So I think this is very difficult because so many of my clients, I'm coming at this as a counselor, not as a sex education or sexuality researcher. But most of my clients, when they were lucky enough to get sexuality education in school or relationship and sexuality education in school, they found out through this education that what had happened to them was actually abuse. And what had happened to them was actually violation, inappropriate, but there was no follow-up. So I think it's really important that as part of getting this proper, comprehensive part of sexuality education involved, we need to have mental health teams at schools that students trust, because when most of the people who go through this will find out that what happened to them was abuse, what do they do with it? Because the way we speak about it is very similar to how we speak about HIV. It's often don't do it, don't get it, become a victim, rather than if you have it, if it has happened to you, if somebody has violated you, What can you do? What are your options? I think it's a really important point. I was having a conversation earlier with a colleague about in my workshops, more often than not, parents deal with their own realization. Oh shit, I was traumatized sexually. I was violated sexually as a child. But they're in the workshop so that they can figure out how to have conversations with their children without passing on the biases that Nike spoke about.
Great. Thanks so much, Casey. Yes, I suppose that this really does, talk back to that point that the provision of comprehensive sexuality education is not something that anybody can just do. There is a lot of evidence, thought, mindfulness, skill, intuition, and self-work and self-reflection that goes into being able to provide the service, especially to young people that are vulnerable. Nikki, it looks like you wanted to contribute, so because you put your mic off, so I'm putting you on the spot. Is there anything that you wanted to add?
Oh, no, not you. It's well said. I think really paying attention to the fact that those who would be doing this work need to go through what's called a SAR, sexual attitude reassessment. All of us have our baggage that we carry. We need to figure it out before we become experts in this area. Tolerance, very important. Acceptance of diversity, respect for these are concrete, significant issues if we're going to be working on a subject matter as delicate as sexuality. Because take it or leave it, it's about the core of our humanity, and we can't deal with it trivially. I think those are the few comments I would like to make. Thank you very much.
Thank you so much, Nikki. And I think that that just is a really wonderful point to close the panel. Esther, would you like to make any closing remarks?
Well, thank you very much, and thank you for all these last comments which have put CSC in the perspective of sexual rights and of human rights, and of the values that CSC upholds, because it does uphold universal values. And this webinar, I think, has been very good, but at the same time, it has raised excellent questions. I think that we have to move forward in exploring all these avenues that have been opened by this webinar, and therefore we all invite you to come to our World Congress in September. You have in the chat box, there's plenty of information of how to register, how to get information about the Congress. And there's nothing more to say but to thank all the participants here, the speakers, and over there, all over the world, our audience. Thank you very much in behalf of the World Association for Sexual Health.
Thank you so much, Esther. And just to add to that, the sexual attitude training that Nikki was talking about will be available leading up to the Congress as one of the pre-conference workshops. So please look out for that. Thank you so much to all the speakers and to Esther for creating such excellent dialogue, and of course to the audience who has really helped create and flesh out the nitty-gritty of sexuality education as a conversation. I'm going to hand back to Anthony to close up for the evening.
Right. Hello, everybody, and Avery and Esther, thank you so much for really moderating a remarkable evening tonight. I think some very important messages, some nuances, big messages, a lot of important detail, and as Esther so rightly said, many questions and much discussion still to come. Thank you to all of you, to the moderators and the speakers, and thank you to Organon for sponsoring us this evening. I think as well, I would at this stage also like to just name and introduce some of the people behind the team who are putting a lot of really hard work into putting together the Congress in September. Some of whom are with us, and some of whom unfortunately couldn't be here to wave and to acknowledge the introduction. First of all, Pedro Nobre, the was president at the helm. of WAS, who unfortunately is unable to be with us tonight. But unlike Louise Perelman, who's the WAS Secretary General and Treasurer, who I'd like to also introduce you to, Louise. And of course, you've been introduced earlier to Esther Corona, the WAS Vice President, who has so ably and articulated and moderated this evening. Esther, welcome and goodbye again. Alain Giami, who I don't think is with us this evening, the Scientific Committee President. On to Elna Rudolph, the Congress President. Elna, hello. Avri, thank you for being the kind of brains and the head behind the webinar organization tonight, and also to everybody behind the scenes, Corlia and Ron, for all the really hard work that goes into making up a webinar like this evening. And certainly also to Osmo Kontula, the WAS Sexuality Education Committee, but indeed to everybody on the panel tonight and to all of you for joining us. We urge you to become members of WAS and of Sasha, and to remind you that you can register for the Congress and you can submit your abstracts. Submissions are open now. Our next webinar is going to be in a month. It will be on sexual health in public health, called Settings, Help and Hindrances. And we invite you to join us. In the meantime, I wish you on behalf of Sasha and WAS a good night, be safe, and in good sexual health.